So tonight's presentation is safeguarding the home. So here is an image to explain what dementia is. There's a lot of misconceptions about this. A lot of people ask me all the time, what is the difference between Alzheimer's and dementia? And actually, it's really simple. Alzheimer's is the cause, and dementia is all the symptoms. So when you look at this image, there's an umbrella of symptoms, things like executive functioning, memory deficits, movement challenges, all of those kind of fall under an umbrella of symptoms. So it's not a disease per se, and underneath that you have different types of dementia. In fact, there's over 100 different types of dementia, and many people usually get flabbergasted by that and say, whoa. However, most of the population is made up of Alzheimer's disease, making up 75% of the dementia population. One thing I want to leave everybody on the call with is the importance of getting an accurate diagnosis, because this changes our care techniques, what you can do to keep that person safe, and also programming and treatment. Most people get dementia unspecified, which means that they have symptoms, but not all the time will they actually get a label of a condition. I'll share just really quickly in a nutshell how different these are. Alzheimer's, most common type, but short-term memory deficits. Don't remember what they had for breakfast, but remember 1920, 1930, might not remember something they said a few minutes ago. Vascular dementia, which is the second most common type, hallmarked by inconsistent symptoms. This is when one day they know who you are, the next day they don't know who you are. Might have some paranoia because they remember a family member, the next moment they don't remember a family member. Can be caused by a number of different things like TIAs, transient ischemic attacks, limbic stroke, and there's a number of them as well. The best preventative is actually physical exercise, but we won't talk too much about preventatives right this second. And then the third one is dementia with Lewy body, hallmarked by severe hallucinations. These people should not watch the news. And even research shows that the color black from the kneecap down can be perceived as scary. So keeping in mind the color shoes a caregiver wears or a family member, the color pants, even a black mat or a black trash barrel can create some paranoia for somebody with Lewy body. And then frontal temporal dementia, which has no hallmark, they're going to say whatever pops in their mind. So for families, sometimes they'll say, well, I don't want to get embarrassed bringing my loved one out to dinner, but sometimes they'll say inappropriate things, and that's okay. One technique you can do is get a piece of paper, right? Please be patient, I'm with somebody with dementia, or my loved one has dementia, please be patient. When that comes up, you just slip that paper to them, and people will change the way that they approach them, and they won't think so much if they do say something inappropriate. So that in a nutshell just shows those four types of dementia, how vastly different they are. And when you look at the living environment, it is vastly different as well. So if somebody's living at home with Lewy body or Alzheimer's, your home's gonna change in safeguarding that house. The one thing I do love about most organizations is that they do a lot of research on the sizing of the door, ADA compliance, to really make it an easy transition. And the one thing I always say about caring for somebody with dementia is being a caregiver can be really tough. So finding ways that you can really be the spouse again, or the daughter, or the friend. So trying to find ways to help them be successful. So once again, you can sit in that seat of being a friend or spouse versus being a caregiver. And some of these techniques will take some of that dementia symptom away to make sure you get that back. So there's also some misconceptions. So there's something called reversible dementia and curable dementia, which a lot of people scratch their head and say, what is that? Because dementia is a group of symptoms, there are things like delirium, medication side effects. Somebody having too many medications can create dementia symptoms, clinical depression, vitamin deficiencies, alcoholism, tumors, or something as simple as a UTI. Many seniors, when they get a UTI, urinary tract infection or bladder infection, can undergo dementia symptoms. And that can look like Alzheimer's. So when you're seeing some dementia symptoms pop up, don't automatically assume it's Alzheimer's or vascular. But there's also many things that we could change that might not even be dementia at all. So keep that in mind. So always work with a medical professional to rule those things out. Don't scare yourself and then wait to the last minute. Early detection is really important. So making sure that you're proactive when you see symptoms as quick as you can. Normal aging and dementia, I just want to break the misconception with this, because I get a lot of people that say, well, dementia is just part of aging, and that is not true. It's an accelerated rate of cognitive decline. Normal aging will look like this. You might forget where you put your money, where your keys, where you parked, might get lost with directions. That's normal. As we age, we all have cognitive decline. We will all undergo some cognitive challenges as we age. Dementia will look more like this. The remote in the refrigerator, the keys in the trash, hopping on the highway and driving 3 or 4 hours across state lines and not knowing where they ended up, where they get that call. Those are red flags. Not always dementia, could be a clinical depression like we talked about, could be some dementia symptoms, but not always is it a permanent type of dementia. So don't get alarmed, just work with your healthcare professionals and try to rule those things out. And like I said, early detection is really important. But you can see how they're different and to break that misconception. There's also 7 stages. A useful tool I always tell families is you can go on Google and type in GDS scale, and it will break down what each stage looks like. If you're curious of where your loved one might be, or if somebody has dementia, that will break down what 7 stages of dementia looks like, and you can fit that person in there based on a narrative. Most assisted livings refer to this as early, mid, and late stages. What's really great is with good programming and a great therapeutic approach, you can sustain symptoms for a long time where you don't see as much progression. Even research during COVID is showing that with social isolation or not being neurologically stimulated, that people are having more symptoms. Even in one of our research communities, we had somebody on hospice. Once we started opening the doors for some visits, she bounced off hospice for a period of time. She did go back, but it was amazing to see the human connection help people. And I would say connection with people with dementia is incredibly, incredibly important. This is also just breaking down the mid, moderate, and severe stages. People can sit in these for different periods of time. For example, mid could be from 2 to 4 years, moderate 2 to 10, and severe could be 1 to 3. I would say most of the time what I see is it's towards the beginning of the numbers. So 2 years, 2 years, and 1 year. And that's just the way that our healthcare system is kind of backing up. And it also changes depending on the type of dementia that they have. For example, Alzheimer's, you'll see a gradual decrease over time. With good stimulation, you can actually give it a little bit of a facelift and let it go coast for a longer period of time. Things like Lewy bodies or vascular, sometimes you'll see pockets of decline. So it looks different depending on what type of dementia you have. So just be mindful of that. And this is the last slide in this section, but for Alzheimer's, which is the most common type, it can be misdiagnosed quite a bit. In addition is that there's no FDA-approved medications that actually treat the disease. So biologically, that disease is still progressing, but behaviorally, we can actually decrease symptoms. And that's when some of the medicine you take boosts acetylcholine. It can actually help with cognition for a period of time, but also be mindful, work with your clinician or your PCP, because sometimes these medications can also create a lot of side effects. Things like an inflamed enteric nervous system, which will make your gut feel uncomfortable. Then you're prescribed a few more medications and a few more medications. I've seen people on 10, 15 medications just to treat side effects. So it's really good to just keep your thumb and your pulse on that and work with your medical professional just to keep an eye on it as much as possible.